Hey everybody, Becky and Boca here. I filmed my show this week outside the studio. I took a cameraman and some lighting to Dr. Stephen Fagien's office in Boca Raton, and I filmed him doing my facial injectables. Just in case you're wondering exactly what that entails, you're going to see it all. It's about a week later now. I'm very happy with it. So sit back, relax, and enjoy the show. I am outside Dr. Steve Fagien's office in Boca Raton. I'm going in to get my facial injectables done. I have no makeup on, so I'm trying to hide behind these glasses. I hate not wearing makeup, but you can't wear makeup if you're going to get your injectables. So come on inside, and I will show you how this works. Okay, this is it, Dr. Stephen Fagien. Come on in. This is the lobby. It's absolutely gorgeous. It's beautiful everything. It's very calming, very relaxing too. It's like a spa. So you get nice and calm, and then you go in and you get your injectables. We're going in.
Hi, my name is Oni. Okay, just follow me. And we're gonna check in over here. This is our waiting room right here. Okay, and this is our front desk.
Go ahead.
Okay.
How are you doing today? I'm
Good.
Davina,
Hi,
Dr.
Davina.
Fagien's medical assistant.
Okay,
I'll
nice to
be
meet you.
Nice to meet you too. I'll be finding out a little bit about your visit today and what you're going to be doing with Dr. Fagien.
Okay.
Have you had any Botox or any fillers since then?
Yes.
Okay. When was the last time you had Botox?
Probably about 4 or 5 months ago.
Okay, and what areas were you treated in?
That was just, I believe, forehead and maybe around the eye.
What about filler? When was the last time you had filler?
That would have been about over a year ago.
Okay. Do you remember what product was used?
I'm going to say Juvederm, but
Okay.
I'm not sure.
Okay. And what areas were you hoping to treat today? I know typically you do your forehead with Botox, your crow's feet, your glabella. Are you thinking
Right.
the same for your Botox today?
Yes.
Okay. And then as far as filler, you usually do a little in your nasolabial folds and your lips.
Yeah. What I do want to do about the lips is they turn down. Well, you know that. See
Okay.
how my lips, like if I'm not
So the oral
smiling,
commissures?
they go down. And I
Okay.
know he can do something to raise up the corners of my lips,
To lift
right?
the corners of the lips?
Yeah.
Okay,
That's what
sounds
I
good. Any in the nasolabial folds?
If he thinks I need it,
Okay.
I'm going to kind of leave it up to him.
It's called Jeuveau, and it is a botulinum toxin. So Dr. Fagien did the FDA studies for the drug, which was indicated for the glabella area. We started treating patients with it over the summer, and we have patients from different spectrums, telling us their feedback about the drug. So you might want to know, well, what's the difference? So the difference with the drug is that patients say that the onset of the drug is the next day or a day or two after treatment, whereas Botox, it's about a week out after treatment. We do have a few patients that will say they can stretch it out a little bit longer than Botox. It is a bit of a softer look. Patients that usually like a bit more of that frozen look, Dr. Fagien says this is a little bit softer.
Have you taken any Aleve or any blood thinners today?
No.
Okay. Very good. I'm going to give you a little makeup remover and we can get started, okay?
Okay.
This probably can also take a picture as well.
Yeah.
Okay? I'm going to get you a mirror. Very good. Okay.
Last thing I want to do is be on camera with absolutely no makeup, but I don't have a choice. Yeah, when you did my show, you were wearing the blue scrubs and I had a blue dress, and it worked out perfectly. And I'm wearing blue again.
Well, the first thing I like to do, especially since I like to give patients who are maybe a little sensitive to discomfort, a little local anesthetic, and I do it like a dental block. But before I do that, so I know the landmarks where I'm injecting, I'll mark the area.
Okay, go ahead.
Chin up and drop. Hold lips together gently. Now relax, no smile, just lips softly together. Good. And look straight. Cleanse it with a little alcohol first. Sometimes if I'm using volume in the midface, I'll do a little more of a skin cleansing with chlorhexidine or betadine. Juvederm, which we're going to use here
We're going to use Juvederm in the...
in the nasolabial folds, and
Okay.
we talked about the downturn of the mouth. These oral commissures that people talk about, the downturn, very difficult to treat.
I've noticed that in the mirror a lot lately. If I'm
And-
not smiling, it
And
looks like I'm frowning.
You're not alone. And the problem with oral commissures is people think they can just volumize, in other words, put a lot of product in here and work their way out of the downturn, and you can't, because it's that muscle dominance again. Your lip depressors now overwhelm your ability for your soft tissue to resist it. It happens everywhere on the face, including the oral commissure, so it's not just a volume problem. And I'll also put a little bit of neurotoxin, we'll use Jeuveau today, to reduce the depressor activity and then strengthen the soft tissue by putting a small amount of volume here at that downturn called the oral commissure. Okay, now turn towards me again just a bit. Now if you look, there's a little bit, like most people have, a little lip asymmetry.
Mhm.
You have more prominence here, less prominence here. So I'll put a little more on this side. And then we tend to lose our filtral column. Here and here. And so our lip gets longer and flatter. And you want to have a little contour. And that's all you really want to do in lips, especially when people, I think people should rightfully be scared of too big lips. I think we see all these people walking around, you wonder what they were thinking or their injector, healthcare provider was thinking when they really just inflate those lips.
And
too.
people ask for that.
They do.
I know.
They do, unfortunately. And then, it's our job as healthcare providers to talk them out of it.
Yeah, I agree.
So, all right, what I like to do,
This is a dental block you're doing?
dental block, and they use a little vibrator. That helps quite a bit. So the vibrator goes on the air in the nasolabial fold first, and then we go through the mouth, inject a little air, and right there. And the key to anesthetic injection, and injections in general, safer, less painful injections are done slowly. Keep the on there, perfect, just like that. Here, let go. Not terrible?
No, not terrible.
We do the little round the patient thing where we go to
Okay.
both sides. Same thing on this side. Yeah. Just go very slowly. And you can feel it. Feel the burning of the anesthetic, but not terrible. And the vibrator. It's an interesting phenomenon, too, in vibration sense. Reduces pain.
Yeah, I get that at the dentist, too.
Yeah, and it's called the gate theory of pain. The gate theory is that the afferent pathways of pain and vibration are the same. It's the same highway taking it to the brain. And if you clog the highway with vibration, you don't give enough room for pain, the sensation to get to the brain. And you can see, you feel probably a little numb already, and even your upper
Yeah.
lip feels a little numb.
Mm-hmm.
Do a little bit to the commissures. These tend to be a little more uncomfortable. Little poke, little air. And you can tell, despite the fact you wouldn't think the corner of the mouth is just uncomfortable, it is.
Mm-hmm.
That's it on that side. And we'll do the roundabout again. Okay, we'll do the same thing on this side. You can tell your upper lip's starting to get a little numb, and the reason is I'm waiting to inject that last. A little poke here. Okay. Let's get back. You all right?
Mm-hmm.
Okay. What? Not so terrible?
No, not terrible at all. It didn't hurt. I'm just starting to feel numb.
The upper lip starting to feel a little numb?
Mm-hmm.
Okay, and that's the time I do a little in the upper lip. Here. Okay. Yeah, same thing over here.
Didn't even feel that one.
Good. And you're good. So what we'll do now, if you could, Olivia, just hold pressure over there. Not that Becky can now talk because she recovered her mouth. So what I'll do again, get some structure here. With a little reconstituted Juvederm. And then a little bit in here. May feel a little bit there. Just a drop. Similarly, a little pressure here. Hold it like that. Oh, look at you, Becky.
I was trying to be helpful.
Everything at once. Not much discomfort.
No, I don't feel anything.
Good. Hold it there again. You would. Hold just like that. We'll go back to the other side. It's got a bit of a champagne consistency. There's bubbles in there. And I actually have people say, oh, bubbles harmful. Not at all. In fact, it mixes up the product very well, so you can reconstitute and essentially dilute it so that you can make the injections more superficial. And the products are much more efficient when you can place them superficially. If you place them deep, you lose the lift effect, unless you put an extraordinary amount of volume, which then looks completely ridiculous. The last thing I'll do to lift the corner is this. Is bridge the commissure and basically inject upwards. And you can see it lift when you do that. And it pulls that corner of the mouth up just slightly. And of course you're going to be a little swollen from these injections, and that goes away. Just a bit. Okay, so the key on
I'll get you. Okay.
injecting neurotoxins, you know, everybody can inject neurotoxin. So injecting is not the problem. It's really evaluating the face and see where it's going to work best. And then the choice of which neurotoxin you use does influence your injection pattern as well. We're going to use the new one, Jeuveau, which I think is a great drug.
We talked about that on my show.
Yeah. It's so it's the first neurotoxin, unlike Dysport and Xeomin, which have been out for a while, that really works almost identical to Botox, but not completely. So there's some nuances that I've learned with Jeuveau, particularly in the forehead, where unlike in these areas where all the drugs work very similar and the injection patterns are the same, everybody injects foreheads differently. And you have to know that and then know how to use this drug to get the best result. So if I evaluate you, turn this way just a little. Actually, turn yours made.
Okay.
Look right here. Your left tail of your brow is higher than the right.
Mm-hmm.
So in order to not accentuate that and to achieve some symmetry, you want to take that into consideration. And I won't inject as high on this left side. So smile just a bit. You watch people animate. You can let go here too if you like. And smile really good. Hard to do with it numbing, right? Okay, now relax. So you're less animated on this side too, but and I use a 4cc dilution. I think it works because I get more mechanical spread of the drug using a little more volume. Smile again and relax again. And my theory with Jeuveau, and we're going to prove that with a clinical study with a group up in Boston, hold right here, please, and hold it up and out, is that the field of effect is slightly tighter with Jeuveau, which is interesting. In other words, a little more precise. Dysport we know spreads more. Botox has been kind of the gold standard. Jeuveau has an even tighter field of effect, so I find the volume helps. Now, on this low brow side, I'm going to go way up to the tail of the brow here. Take another one with a 32, please. Thank you. So what you see is Becky's holding a little pressure. That helps distribute it in one, not massage, but just pressure, and helps avoid bruising in someone who's got type 1, type 2 skin who tends to bruise very easily. As you see I did with her oral commissure. Smile just a bit and relax. Okay, now let go here. Hold there again, smile again, and relax. And if you go superficial, you're not going to get any of the cheek elevators. So hold here if you can.
Oh, you hold that one?
Yeah, if you can.
Yeah.
You want to switch?
Yeah.
Oh, look at
we
you.
Need, we need,
So
we need the
talented.
microphone.
So talented, Becky. I knew you could do it. Okay. And with the glabella, again, most people inject the glabella area between the brows for the frown lines, pretty similar. Now frown really hard and relax, but you got to look at brow shape. If you look at Becky's, hold there and there, brow kind of comes up and then comes down. So it's got more or less on this side of a lateral arch like she has on this side. So I pay attention to that because I will inject a little differently on each side. So I frown again, and she goes way out to here. The corrugator really inserts into skin here. Now close gently. I'm going to stay a little low here. These hurt a little bit, and higher on here. And if you feel the notch, you can avoid the supraorbital artery, which just causes bruising and pain because the supraorbital nerve is there as well. Now here I'm going to stay a little low. And these hurt. You can tell she's wincing a little bit. But there you avoid bruising. And bleeding.
Worth it.
Worth it. And then the Proceris, again, most of us inject it similarly. Frown really hard. It what pulls the brows medially down. Now relax. Is I will inject here. Very superficially. Try to avoid bruising. And here. And that's pretty much the frown line area. Now, one of the other cool things that I think Botox and neurotoxins and Jeuveau and all of them are underutilized is in the chin.
Yeah, I remember you injected me in the chin last
If
time.
you watch how Becky speaks, even with anesthetic in there, had a lot of movement in mentalis. Thank you. And what I do, you can do a paired injection because it's a paired muscle, but I find to get less lip asymmetry is I'll inject just centrally, right here. And inject as I withdraw and get the superficial component of the mentalis as well. And it evenly affects both sides if you do it that way. Good. You can let go here, Becky. You're good. So again, the little pressure avoids bruising and bleeding as best as you can. Good.
Okay.
Now we're going to do again, watch people's movement. And I find Jeuveau, since it's got a smaller field of effect, may need a higher dilution like we do. I do use a 4 cc on label for most of these products for like Botox. There's 2.5 cc's per vial. I do a 4. I think, as I mentioned, I think it distributes better. Okay. And raise your eyebrows just a bit and relax. So it raises this one much more freely. So I want to stay a little higher on this side. Raise again. And relax. Raise again, please, and relax. And go here. Raise again. Okay, she raises this one a little higher, so I'm going to go a little lower on this side. And raise again just a bit. Raise again just a bit, and relax. So follow where you believe the frontalis muscle is. Raise again and relax. So you got a little less function on this side. Raise again and relax again. I'll take 2 new wet gauze, please. Thank you. And that Becky, is it.
That's it?
That's it.
Okay.
That's a wrap.
All
You
right.
did great.
Thank you.
You're welcome.
Okay, I guess I'm all done, huh? What do you think, Oni?
You're done. You will look beautiful. New Becky.
A new Becky.
Yes.
Okay, well, thank you very much. It's a beautiful office. Dr. Fagien is fantastic, and I can't wait to see how this turns out.
Me too.
Okay, well, there you go. I hope you enjoyed the show. It's been about 6 days, almost a full week now, since I did the injectables with Dr. Fagien, and I am very pleased with the way they turned out. The Jeuveau was interesting because it seemed to develop a little more quickly than most neurotoxins would. It's been, like I said, less than a week, and I can already see the results. I'm very happy with it. Anybody that follows my show knows that I had facial cosmetics surgery, and people ask me, if you did that, why do you still do facial injectables? I love the results of my surgery. Got rid of my turkey neck, tightened everything up, but that doesn't mean that you can't still benefit from neurotoxins and fillers. Now you know exactly what goes on when you go to get your facial injectables, and I think you can appreciate from this film the fact that it's very important to have the right injector. It's not just about the product, it's about the quality of the injector. So you have to find a good one like Dr. Stephen Fagien. Becky and Boca from Boca Raton, Florida, signing off. You have been watching and listening to The Becky and Boca Show.